Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, and I would like to officially welcome you to episode 74 of the Ask Dr. Angela podcast. I am rocking and rolling. Anyway, I've had so much stuff going on between the podcast, the blog post, and being in the final editing stages of my pregnancy book. I feel like I've been in the final editing stages of my pregnancy book for an eternity. It's like purgatory, if you will. And my editor, who's this really huge Jamaican guy named Hugh that we affectionately call Hug, says to me, Ange, nobody likes the editing because it's not sexy. No, the editing part is not sexy. But I've got to tell you, we are closing in on this baby. Getting ready to shoot the cover for the book. And so I'm really excited to be able to present this to you all because it's funny, it's witty, it's charming, it's compassionate, and it's just the way that I talk to you, my patients. At times I've wanted to pull my hair out, and at this stage in the game, I have wild, crazy curls that I could pull out. I think I told you that my daughter asked me to let my hair grow. It's so funny because just yesterday she said to me, Mommy, you can get your hair low again. And I'm like, really? And now I'm like in this whole in-between stage. And ladies, you know what it is. So we'll see. Maybe I'll go back to the low. So let's jump right into today's topic. Today's topic has to do with pain and irregular bleeding with an IUD. If you're getting that, you should get it checked out. First of all, depending on the type of IUD that you have, i.e. Paragard, this might be the norm for you. One of the reasons that I typically am not a huge fan of the Paragard is because it can cause just that. Painful periods, irregular bleeding. Some folks like the Paragard for whatever reason. Some folks can't be on anything that's hormonal, and that's fine. But I'm just mentioning it to say to you that sometimes it is a natural consequence depending on the type of IUD that you have. However, if you've had an IUD and you've not previously had pain or irregular bleeding, I think it definitely is worth getting checked out. Certainly, your IUD could have migrated, shifted position, or maybe there's something else structural going on that's causing this new pain or bleeding, whether it's like a polyp, a fibroid, maybe an ovarian cyst. I do think that it's certainly worth having checked out. And usually the checking out piece is no more than a pelvic exam to make sure your IUD is not just like hanging out of your cervix, which I've occasionally seen, to maybe doing cultures, making sure there's no new infection, to an ultrasound, again, to check position inside the uterus, as well as to make sure that it is still in the uterus. It's a very rare occasion, but I have seen IUDs migrate. I think that's probably some folks who are kind of hesitant to use IUDs, that's probably one of their biggest fears. So those are my recommendations. If you are having pain and irregular bleeding with an IUD that's new, definitely get it checked out. It's probably nothing, but I prefer that you have an exam and some imaging to support that. Hopefully today's podcast has imparted you with a little bit of knowledge, and hopefully it has added some value to your day. If you have a question or topic that you would like featured on the Ask Dr. Angela podcast, please go to www.askdrangela, that's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. My boy O is always like teasing me because he's like, just do what you do. I know how you sound. I know your cadence. I know, it's funny. But anyway, rock the mic. Do what you do. If we do feature your question, someone from my team will reach out to you and we'll gather your information and send you one of our bomb ass t-shirts. And they are just that, bomb ass. So in closing, let me leave you with this quote from Gail Sheehy. If we don't change, we don't grow. if we don't grow, we aren't really living. So I'm going to ask you, are you growing? And second, are you living? I can't wait to reconnect with you on episode 75 of our next podcast. But until then, look better, feel better, be better.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.